Hello, my name is Paul and today I'll be presenting the medical condition type 2 diabetes. What is type 2 diabetes? Type 2 diabetes is a chronic condition where the body becomes insulin resistant and is unable to produce enough insulin to regulate the blood glucose levels. Insulin resistant is when the body is not using the insulin effectively to transport glucose to the cells, causing an excess amount of sugar in the bloodstream. Due to this, the beta cells responsible for producing insulin in the pancreas work harder to produce more insulin to regulate the high blood sugar levels. But over time, these beta cells wear out and are no longer able to produce enough insulin, causing an individual to develop type 2 diabetes. Insulin is a hormone produced by the pancreas that helps transport glucose to different cells and where it is needed, as well as regulating glucose levels in the bloodstream. How is it diagnosed? Type 2 diabetes is diagnosed by considering many factors. These include symptoms such as increased thirst, risk factors such as being overweight, and lifestyle such as poor diet. To confirm the diagnosis, healthcare professionals use results of blood tests such as HbA1c, fasting blood sugar, and glucose tolerance tests that measures blood glucose levels, how the body reacts to glucose, and the level of hemoglobin that has glucose attached to them in the bloodstream. These tests determine if the blood glucose is in the normal ranges and if the patient is at risk for type 2 diabetes or already have it. Pathology tests to diagnose, treat, and manage diabetes. The first is HbA1c. It is a blood test that measures the amount of hemoglobin that has glucose attached to it in the bloodstream. The results would need to indicate 6.5% or higher to be diagnosed for type 2 diabetes. It goes in an EDTA tube transported at room temperature and goes to hematology. The next test is FBS, also known as a fasting blood sugar test. It is a blood test that measures your blood sugar levels at when it is expected to be at its lowest. An individual would need to fast for at least 8 hours before having the test, and results would need to indicate 126 milligrams per deciliter or higher to diagnose for type 2 diabetes. It goes in an SST tube or a flux tube, transported at room temperature, and goes to chemistry. The next test is OGTT or GTT, also known as an oral glucose test. It measures your body's reaction to glucose. This takes roughly 2 hours, and before the test, the individual will need to fast for about 8 hours. This consists of 3 blood tests. The first taken at the start of the glucose tolerance test. This measures the fasting glucose level. After that, the patient is then given a glucose drink that contains about 75 grams of sugar to drink within 5 minutes. After an hour, the patient goes back to the clinic to have the second blood test. An hour after the second blood test, they then go back to the clinic to have their third blood test. Results would need to indicate 200 milligrams per deciliter or higher to be diagnosed for diabetes. This requires 3 fluoride oxalate test tubes, transported at room temperature and taken to chemistry. Treatment for type 2 diabetes. Though type 2 diabetes doesn't have a cure, there are many other ways to help manage and control it. These treatments include a change in lifestyle and different medications. Lifestyle changes include physical activity. Having regular, moderate to intense physical activity is important for individuals who have type 2 diabetes. This allows for them to lose weight, improve blood flow, and most importantly, help lower their blood sugar levels naturally. Diet. It is important for these individuals to change their diets. This can include a change in portion size as well as the variety of food they're eating. Making sure they're eating well-balanced meals with lean proteins, non-starchy vegetables, good fats, and complex carbohydrates can help regulate blood sugar levels. They may also be referred to a dietitian to help with this. There are many different types of medications used to regulate blood glucose levels. Here are some of the main medications used. Oral medications include biguanide, more commonly known as metformin. This medication helps the body regulate blood glucose levels by limiting the release of glucose by the liver and enhancing the cell's ability to react to insulin. Sulfonylureas, such as glycoside. This medication helps the pancreas produce more insulin. Sodium glucose transporter 2 inhibitors, such as empagliflozin. This medication limits the kidney's ability to keep sugar so that the sugar is excreted through the urine. Injectable medications include synthetic insulin. This can be short-acting or long-acting, and it helps regulate the blood glucose levels. GLP-1 receptor antagonists such as Ozempic and Mounjaro. These medications increase the release of insulin as the blood sugar level rises. Medical terms. The first is hyperglycemia, which means high blood sugar. Prefix hyper, which means high. Root word glycus, which means sugar. Suffix hemia, which means blood. The second is polydipsia, which means more thirst or more thirsty. Prefix poly, which means many or much, and root word dipsia, which means thirst. The third word is hemoglobin, which is a protein of the blood. Prefix hem or hemo, which means blood. Suffix globin, which means protein. The next is dietitian, which is a practitioner specialized in food or diet. Root word diet, which means food. Suffix itian, which means specialist. The last word is endocrine, which means any tissue that secretes hormones. The prefix is endo, which means within, and the root word crine, which means to separate or excrete. And here are my references.